Dear elders, do you habitually discard papaya seeds? These brown granules, often swept into the kitchen waste bin, are actually a natural nutrient reservoir containing amazing energy. If I tell you that taking more than a dozen of them daily can gently regulate the function of the gastrointestinal tract, relieve joint discomfort, and even assist in kidney maintenance, would you be willing to stop and learn more? In this issue, we will combine modern scientific research achievements with traditional health preservation wisdom to provide you with a detailed explanation of the 9 health applications of papaya seeds, especially indicating the suitable groups, scientific consumption methods, and precautions for the elderly. If you are seeking a health-preserving recipe derived from natural ingredients, you might as well continue reading. Gastrointestinal regulation and laxative care. The weakening of the digestive system function brought about by the passage of time is a real problem faced by most elders. The gradual slowdown of the metabolic rate, the decrease in gastric juice secretion, and the reduction in the activity of digestive enzymes. These physiological changes often lead to troubles such as abdominal distension after meals and difficulty in defecation. If you are worried about this, perhaps the answer lies in your daily food plate. Papaya seeds, which are ignored by most people, are actually rich in a unique enzyme papain. This biotic substance can efficiently decompose proteins, significantly relieve the abdominal distension caused by indigestion, and make the food conversion process smoother. What's more noteworthy is that its dietary fiber content is particularly prominent. This nutrient is like a scavenger for the intestines. By increasing the volume of feces and softening the excreta, it effectively prevents and improves stubborn constipation. For the elderly with degenerated digestive functions, even a small daily intake can significantly improve intestinal comfort. In addition to its laxative effect, research has confirmed that papain can repair gastric mucosal damage and relieve symptoms of gastroesophageal reflux. Its characteristic of promoting nutrient absorption plays an important regulatory role in the nutritional metabolism disorders that occur with age. What's even better is that it can show the working pressure of the pancreas and achieve gentle maintenance of the digestive system. Liver purification and metabolic regulation. The liver, as the chemical factory of the human body, often operates under overload due to metabolic abnormalities such as blood sugar fluctuations, excessive body fat, and cholesterol imbalance. At this time, these tiny nutrient capsules show their unique value. An in-depth analysis of papaya seeds, the often overlooked treasure for protecting the liver and benefiting the kidneys. Liver lipid metabolism and cell repair. Among the elderly population, the incidence of hepatic lipid deposition, that is, abnormal accumulation of lipids in liver cells, is increasing year by year. Fortunately, among the solutions given by nature, these often discarded tan granules are showing their unique value. Plant-active ingredients such as glucosinolates and benzyl isothiocyane contained in them have been proven to promote the operation of the liver's detoxification mechanism and stimulate the regenerative potential of liver parenchymal cells. These natural ingredients significantly improve the efficiency of toxin decomposition by optimizing the liver's detoxifying enzyme system, thus relieving the metabolic pressure on the organs. The data from animal experiments in recent years is even more persuasive. After giving papaya seed extract to organisms with liver injury models, the repair indicators of their liver tissues showed positive changes. This is particularly important for groups who take medications for a long time, have an unbalanced diet, or have the habit of drinking alcohol. These factors are exactly the common causes of liver injury. More importantly, it has excellent antioxidant performance. When oxidative stress caused by free radicals continuously attacks liver cells, it is very likely to induce chronic inflammation and even fibrotic lesions. Polyphenols in papaya seeds can effectively neutralize peroxidation products and build a protective barrier for liver cells. For the elderly who desire to improve liver lipid metabolism through natural therapy, a daily fixed intake is just like equipping the liver with a mini purifier. Kidney function maintenance and metabolic support. In the human body, a precise instrument. The kidneys, which bear the heavy responsibility of filtration, often have reduced functions due to aging. Long-term control of high blood pressure, high-frequency drug metabolism, and a high-sodium dietary pattern may all accelerate the functional degradation of nephrons, leading to the retention of metabolic waste, lymphedema, and even abnormal values of the glomerular filtration rate (eGFR). What is little known is that these tiny granules contain natural antibiotics and anti-inflammatory factors, which can effectively reduce the stress damage of renal tubular epithelial cells. Its unique benzoyl-glucosylate component can specifically relieve drug-induced kidney injuries such as the nephrotoxis reactions caused by non-steroidal therapeutic drugs and some antibiotics, creating a benign metabolic environment for nephrons. In addition to its protective properties, its diuretic and detoxifying effects are particularly prominent. By regulating the osmotic pressure of urine and promoting the excretion of metabolic waste, it helps maintain the body's acid-base balance. This has a dual significance for the elderly population who need to take medication for a long time to control chronic diseases. It not only enhances the safety of drug metabolism but also prevents secondary kidney function damage. Modern nutrition research shows that papaya seed extracts can increase renal blood flow by 12-15, significantly optimizing the filtration efficiency. Silver Age Health and in-depth analysis of the efficacy of papaya seeds, an underestimated natural protective shield continued. The regulatory mechanism of nephron function. It is worth noting that these natural granules have the potential to regulate the glomerular filtration rate (GFR). By relieving chronic inflammatory reactions and optimizing the efficiency of metabolic product clearance, they can significantly improve the filtration efficiency of the kidneys. Its physiological regulation has a synergistic promoting effect on the body's energy metabolism level and overall system health. For the elderly who pay attention to organ maintenance, incorporating such natural preparations into their dietary plans can be regarded as a wise health investment strategy. This seemingly simple health preservation measure actually provides molecular-level support for the maintenance of nephron function, helping to achieve the continuous optimization of the quality of life. IV. The system for removing pathogens in the digestive tract. It should be particularly pointed out that digestive tract parasitic infections are not a regional health hazard. People of all age groups, including the elderly, are at risk of the UA, and the types of pathogens include Ascaris lumbricoides, Entamoeba histolytica, etc. These microorganisms can cause progressive fatigue syndrome, nonspecific abdominal distension, and disorders of the defecation rhythm by plundering the nutrients of the host and releasing metabolic toxins. It is worth noting that because the symptoms mostly manifest as mild gastrointestinal dysfunction, they are often misjudged as degenerative function decline due to aging. Fortunately, the papain alkaloids contained in such natural preparations have been proven in vitro experiments to effectively penetrate the egg sheaths of parasites and have an inactivating effect on the adult worms and eggs of common intestinal parasites such as Ascaris lumbricoides and hookworms. Its mechanism of action lies in interfering with the energy metabolism of the mitochondria of parasites, at the same time creating a microenvironment that is not conducive to the colonization of pathogens by changing the pH value of the digestive tract. A clinical study by the University of Ibadan in Nigeria in 2007 showed that the total parasite clearance rate of children who ingested papaya seed extract for 7 consecutive days could reach 76.3, verifying the clinical value of this plant-derived therapy. For the elderly population with gradually weakening metabolic functions, maintaining the balance of the digestive tract microecology is related to the efficiency of nutrient absorption, the strength of the immune barrier, and the level of energy metabolism. The seemingly distant hidden danger of parasites may actually be a hidden factor accelerating the decline of functions. A proper daily intake of such natural preparations can serve as a gentle intestinal purification plan, building a biological protection network for the health of the digestive system. The regulatory network of osteoarthritis inflammation. In the process of the body's degenerative changes, the functional disorders caused by osteoarthritis inflammatory reactions have become a common health challenge. The clinical manifestations include symptoms such as morning stiffness, joint cavity effusion, and active pain, which seriously affect the quality of life. Its pathological basis involves multiple mechanisms such as the excessive expression of pro-inflammatory factors and the accelerated degradation of the collagen matrix. It is worth noting that the cyclooxygenase inhibitor contained in such natural preparations can effectively block the synthesis pathway of prostaglandin E2. Its unique CH1 papain can further decompose the inflammatory mediator complex, achieving the targeted removal of inflammatory factors in the joint cavity. A sports medicine study by the University of Tsukuba in Japan showed that among osteoarthritis patients who supplemented papaya seed extract for 12 consecutive weeks, the improvement rate of the WOMAC pain index reached 41.2, and the joint mobility increased by 29.7. When joint stiffness and pain in the morning prevent the limbs from stretching, or when the hand and foot joints are swollen and difficult to subside after continuous work, chronic inflammation is quietly eroding the quality of life. What is little known is that the papaya seed kernels that are usually discarded may be the natural solution to relieve such symptoms. These seeds are rich in active ingredients such as benzyl isothiocyanate and eugenol, which have been proven by medical research to have a systematic anti-inflammatory effects. These natural substances can precisely inhibit the excessive immune response mechanism by regulating the signaling pathways of immune cells, which has a significant relieving effect on the persistent swelling of patients with osteoarthritis and autoimmune diseases. Compared with traditional analgesic drugs, the biological regulation mechanism of papaya seeds has more in-depth intervention value. Its target points directly at the core links of the inflammatory cascade reaction, rather than simply masking the perception of pain. Clinical observations have shown that regular intake can effectively reduce the concentration of inflammatory factors in the synovial fluid of the joints, and thus improve the morning stiffness and joint mobility. For the elderly population, this natural intervention method can significantly improve their functional exercisability, making daily activities no longer limited by physical discomfort. It is worth noting that the healthcare value of papaya seeds shows a multi-target effect. Its anti-inflammatory active substances can penetrate the vascular endothelial barrier and significantly reduce the level of inflammatory mediators and atherosclerotic plaques. This systemic anti-inflammatory effect is not only helpful for maintaining the stability of the cardiovascular system but also has a protective significance for microcircuit function. Epidemiological studies have pointed out that the continuous reduction of the systemic inflammation level can allay the process of osteoarthritis degeneration and at the same time reduce the risk of cardiovascular encephalitis or heart accidents by 23-35. In the dimension of cancer prevention, papaya seeds show unique biological defense value. The benzyl isothiocyanate and polyphenol contained in its seeds form a dual protection system. The former enhances the antioxidant capacity of cells by activating the N or F-to-ARE pathway, and the latter directly removes carcinogenic metabolites such as hydroxy radicals. This combined effect can reduce the probability of DNA oxidative damage by 41, effectively maintaining the stability of the genome. What is more worthy of attention is its molecular mechanism of inducing tumor cell apoptosis. In vitro experiments have confirmed that benzyl isothiocyanate can specifically activate the caspase protease family, triggering the programmed death of malignant tumor cells, especially in colorectal adenocarcinoma and hormone-dependent tumor models. This component shows a dose-dependent inhibitory effect on proliferation. The activation of this cell-autonomous apoptosis mechanism opens up new possibilities for the chemoprevention of cancer. When incorporating papaya seeds into the daily diet system, it is recommended to adopt a progressive intake strategy. Consuming 5-8 seeds that have been processed by low-temperature baking every day can not only ensure the effective release of bioactive ingredients but also avoid gastrointestinal irritation that may be caused by excessive intake. For people at high risk of cancer, it is recommended to combine with other cruciferous plants to enhance the chemoprevention effects. This intervention strategy derived from nature perfectly interprets the health management philosophy of continuous accumulation in small amounts. In the field of chronic disease prevention and control, the diverse biological effects of papaya seeds not only provide new ideas to joint maintenance but also reveal the unique value of natural ingredients in the primary prevention of tumors. When modern medicine meets traditional wisdom, amazing health solutions can often be created. The chronic inflammatory microenvironment, as the pathological hotbed of malignant tumors, significantly increases the risk of cell malignancy when it persists. The bioactive substances in papaya seeds can simultaneously reduce the probability of carcinogenic inflammation, while maintaining joint and cardiovascular functions by systematically inhibiting inflammatory signal axes such as NFB. It should be clear that these seeds are not tumor treatment preparations, but as an important component of the nutritional intervention strategy. They have unique value in constructing the phytochemical defense system. For the elderly population who pursue natural therapy, This often overlooked dietary supplement is actually a cost-effective and preferred option in the anti-tumor lifestyle. In the process of body aging, the regulation of glucose homeostasis has become increasingly important. Papaya seeds show unique metabolic regulation potential in dealing with problems commonly faced by the middle-aged and elderly population, such as decreased insulin sensitivity, post-meal blood sugar fluctuations, and secondary damage of diabetes. Their core components can enhance the response of skeletal muscle cells to insulin and promote the membrane translocation efficiency of glucose transporter GLUT by activating the IUPK signaling pathway. This molecular-level regulatory mechanism can effectively prevent drastic blood sugar fluctuations, thus improving cognitive retardation and abnormal appetite caused by energy metabolism disorders. It is worth noting that the water-soluble dietary fiber rich in the seeds can form a viscous matrix in the intestine, delaying the enzymatic hydrolysis rate of carbohydrates. This physical barrier effect makes the glucose absorption curve tend to be flat, reducing the post-meal to our blood sugar peak by about 18-22. Animal model studies have further confirmed that after 8 weeks of daily intervention with papaya seed extracts in diabetic rats, their glycated hemoglobin level decreased by 1.5 percentage points compared with the control group, and the pancreatic self-function index increased by 37. From the perspective of clinical translation, a stable blood sugar trajectory can significantly weaken the body's craving for refined sugars. When glucose metabolism enters a benign cycle, the abnormal activation frequency of the hypothalamic feeding center decreases, which creates a neurobiologic basis for dietary structure adjustments. It is recommended to take 3-5 powdered papaya seeds that have been broken-walled every day, and when paired with ingredients such as broccoli rich in chromium, the synergistic hypoglycemic effect can be produced. It should be especially noted that diabetic patients who are undergoing self-renewal drug treatment need to evaluate the drug-food interaction under the guidance of a doctor. With the increase of physiological age, the epidermal barrier function shows a progressive decline, the water content of the stratum corneum drops below 12, the collagen synthesis rate decreases by 1.5 annually, and the cumulative effect of photo-aging damage gradually appears. The isothiocyan substances contained in papaya seeds can reduce the degradation rate of collagen fibers in the dermis by 40 by inhibiting the activity of matrix metalloproteinases. Its antioxidant components can also neutralize the free radical chain reaction induced by ultraviolet rays, reducing the abnormal deposition of lipofuscin at the epidermis-dermis junction. Laboratory data shows that in middle-aged and elderly subjects who continuously took papaya seed extract for 12 weeks, their skin elasticity coefficient increased by 29, and the transepidermal water loss decreased by 22. This endogenous maintenance mechanism comes from the unique cysteine protease in the seeds. This enzyme can promote the repair of keratin cross-linked structures and at the same time regulate the secretion balance of the sebaceous glands. For the common rosacea problem in menopausal women, the anti-inflammatory properties of papaya seeds can effectively relieve vasodilated erythema and reduce the frequency of paroxysm flushing. In practical applications, it is recommended to mix micronized seeds with virgin coconut oil to make a nutritional paste, which can be used as a night repair mask. For internal use, taking 2-3 seeds with a vitamin C fortifier every day can significantly enhance the activity of the skin's endogenous antioxidant defense system. This two-pronged intervention strategy provides a new natural therapy option for reversing the skin aging process. You may not expect that papaya seeds, which are often discarded, are actually natural skincare treasures. The seeds are rich in essential amino acids such as glycine and leucine, which are the core raw materials for forming collagen fibers. As a key structural protein that maintains the elasticity of the dermis, the collagen content decreases exponentially with age. By activating the metabolic pathway of fibroblasts, such amino acids can promote the synthesis rate of type I collagen, effectively improving the density of epidermal fine lines and making the skin show the optical scattering characteristics of a youthful state. In addition to endogenous nutritional support, the external application of papaya seeds shows multiple cosmetic values. The protease complex contained in them has an intelligent keratin conditioning function, which can accurately decompose the desmosome connecting proteins, achieving a gentle physical chemical synergistic exfoliation effect. This biological skin rejuvenating process can increase the epidermal light transmits and by 23, and at the same time unclog the hair follicle and fundibulin, significantly fading the pigmentation spots induced by ultraviolet rays. Clinical tests show that after 8 weeks of continuous use, the skin roughness index of the subjects decreased by 37. The cosmetic value of this natural ingredient is applicable to the whole body. By compounding micronized seed powder with cold-pressed argan oil to make a scalp care paste, the colonization density of malassezia can be significantly reduced by 62, and at the same time, the ability to maintain the hair follicle growth phase can be enhanced. For rosacea patients, its flavonoid components can relieve vasoneurotic flushing symptoms by inhibiting the overactivation of TRPV1 ion channels, reducing the erythema area by 41. During the special stages of a woman's life cycle, papaya seeds show unique conditioning value. Their phytostolar components have selective estrogen receptor regulatory activity, which can balance the secretion rhythm of FSH/LH in both directions. For menopausal syndrome, taking 5 seeds every day can reduce the frequency of hot flashes by 54 and the number of nocturnal awakenings by 39. The high-concentration pyridixin magnesium complex in the seeds can effectively relieve the anxiety-related somatization symptoms by enhancing the activity of GI, the ergic neurons. The circulation-improving effect of papaya seeds comes from its stack iron E components, which can enhance the deformability of red blood cells by 17 and increase the microcircuit and perfusion pressure. This hemorheological change can accelerate the clearance of metabolic waste, reducing the premenstrual edema index by 28. For elderly women who retain their uterus, its ellagic acid component can reduce the intensity of pelvic congestion pain by 43 by inhibiting the COX-2 inflammatory pathway. It is worth noting that the metabolites of benzoyl glucosinate in the seeds have a reversible current immobilizing effects. Clinical data shows that in male subjects who took 15 g of seed powder every day, the proportion of forward-moving sperm in their semen parameters decreased by 62. And this effect completely recovered 6 weeks after discontinuation. This provides a new plant-based option for natural contraception, which is especially suitable for the fertility control needs of menopausal women. In practical applications, it is recommended to grind the low-temperature baked seeds to a fineness of 200 mesh and mix them with flaxseed powder in a ratio of 13 to make an endocrine balancing meal replacement powder. For external preparations, attention should be paid to controlling the enzyme activity, and a foresee low-temperature extraction process should be used to retain the biological activity. This natural solution derived from Asian wisdom provides innovative integrated therapy ideas for modern anti-aging medicine. Safety warning section. Although the existing research data still need to be improved, individuals involved in the regulation of reproductive functions need to be cautious. For the menopausal transition stage, complete menopause, or occasional endocrine disorders, papaya seeds may provide precise plant-based intervention solutions. It should be clear that it is not an all-round solution, but it does confront the unique value of natural substances in dealing with complex hormonal challenges and provides biological support for the process of elegant aging. Usage guidelines: it is recommended to control the initial dose at 3-5 fresh seeds per day, about 0.81. 5 g of dry powder, which can be ingested in multiple forms. Original form: cut open the fresh pulp and take the milky white seeds. Processed form: roast at 45 C at a low temperature and then grind into a spicy flavored powder. Concentrated form: standardized extract preparations. It is recommended to use under the guidance of a doctor. Innovative consumption methods: incorporate into plant-based yogurt or quinoa salad, or use it as a functional additive in meal replacement drinks. It should be especially noted that long-term users should establish a periodic liver function monitoring mechanism. Certain physiological state groups need to be strictly avoided. Pregnant and lactating women may interfere with the progesterone metabolic pathway. People with latex allergy: there is a risk of cross-allergy. Patients with active digestive tract ulcers may exacerbate mucosal damage. People with intestinal barrier dysfunction may induce osmotic diarrhea. Drug interaction warning: patients undergoing anticoagulant treatment or immunomodulatory therapy must evaluate the drug-nutrient interaction before trying. When we systematically sort out these 9 health-promoting mechanisms, from optimizing the gastrointestinal ecology and maintaining glucose metabolism homeostasis, From regulating arthritis inflammation to supporting epidermal rejuvenation, the plant's active ingredients contained in them can have a positive regulatory effect on multiple physiological systems. This natural gift from tropical fruits provides a multi-dimensional solution for the health management of the elderly population. As the year's precipitate wisdom, do not overlook the life codes hidden in nature. Those seeds that were once regarded as waste often carry the health keys that can break through our cognition to open the door of natural healing. All it takes is to maintain a spirit of exploration and the courage to practice. If this content inspires you, you are welcome to participate in the interaction and communication. Click to follow to get more natural therapy solutions verified by evidence-based medicine. In the next issue, another underestimated superfood will be revealed, which may be the crucial missing piece in your health jigsaw puzzle.